Hello, everyone, and welcome to the 8th Annual Artemis Circle Spring Luncheon. My name is Brooke Bartletta, and I am co-chair of Artemis Circle, along with Patrina Martin-Cherry, Donna Venegas, and Katie Willoughby. On behalf of us and our entire leadership committee, thank you for joining us for our first and what will hopefully be our last virtual spring luncheon. Next year, we hope to be back in one of our Boys and Girls Club locations. But for today, we will do our best to bring you the magic, joy, and heart of our clubs virtually. Whether this is your first event or you are a longtime friend, we are thrilled to welcome you to the Artemis Circle community. Thank you for being here as we come together to sustain the extraordinary impact of BGCB. Artemis Circle brings together the energy, passion of like-minded women to make a difference in the lives of our youth by supporting BGCB. Through fundraising, volunteering, and our collective voice, we help sustain BGCB's commitment to help all children, especially those most in need, develop the skills and confidence they need to excel in the 21st century. I got involved with Artemis Circle 8 years ago after being invited to this very luncheon by a friend. Back then, I knew very little about the clubs, but was immediately amazed by the enthusiastic staff, the incredible facilities, and remarkable club alumnus who spoke about his journey and subsequent triumphs, thanks to the encouragement and opportunities provided by BGCB. Artemis was a Greek goddess known as the protector of children, and the idea of being part of a tribe of modern-day Artemises, of protecting our children together, really resonated with me. Upon leaving the luncheon, I made a commitment to continue supporting this vital and necessary organization however I could. Since then, I've had the opportunity to volunteer at the clubs with my children, join the board of trustees, and made wonderful friendships with many of my Artemis Circle women. And here I am, 8 years later, still in awe of the clubs, the resilient members, and especially the caring staff. At a typical luncheon, you have had the opportunity to connect directly with club staff and explore program rooms for education, music, art, social recreation, the gym, pool, and more. But right now, club staff are doing something they have never done in the nearly 130 years BGCB has been serving the community. Since last September, club hours are extended to span the full day, opening at 8 a.m. so youth can attend remote or hybrid school directly from the club. BGCB quickly realized that schools being closed would disproportionately impact its communities and doubled down on educational support to combat disparities in academic opportunity and gaps in technology. Staff assist members with logging into class, help them stay focused, ensure they have a healthy breakfast and lunch, and provide those meaningful moments for kids to let off some steam and just be kids. As members begin returning to schools, BGCB is poised to adjust again and help youth through this transition. Our club staff cannot join us today because they are working tirelessly to be a consistent, trusted, positive support system for youth and families who need us more than ever. Today is a chance to learn more about this special organization and to celebrate the collective power of women making a difference. Just as club staff and the whole BGCB organization has been adapting with innovation and heart, we have reimagined our spring luncheon for the virtual space. And wow, do we have an inspiring program for you. We are so excited to hear from keynote speaker Thea James, Vice President of Mission and Associate Chief Medical Officer at Boston Medical Center, and from a very special guest, Yawkey club member Oasis Ramirez Mateo. To start, I am honored to introduce Boys and Girls Clubs of Boston's Nicholas President and CEO, David Ambrose. Ambrose began his tenure at BGCB just last week, and we are happy to give him a warm Artemis Circle welcome today. We look forward to our continued partnership and doing all we can to sustain the mission and impact of BGCB. And now, please welcome David Ambrose.
Thank you, Brooke. Again, my name is David Ambrose. My friends call me Ambrose, and I hope you will. I'm thrilled to be kicking off what is literally my second week at the Boys and Girls Clubs of Boston with you. As I shared with others, This is a dream role for me, the fruition of a lifelong passion for advocating for children. And I've been taking the time to visit each club safely and engage with the members, the staff, partners, and donors alike there. That includes all of you, and I look forward to meeting each of you in person very soon. That being said, as many of you know, nothing beats witnessing the magic of the clubs firsthand. In these times, however, that could be challenging. Luckily, our friends at NBC 10 helped us capture what makes clubs what they are and how our staff have adapted over the past year to be there for our youth during a most challenging year. Our community's hard work and resiliency is already a great source of pride for me, and I trust you'll be struck by the efforts that they have made as well. Thank you again, and please enjoy our virtual club tour.
When you walk into any door of a Boys and Girls Club, what I want you to feel is the magic. I want you to feel the love. I want you to feel the close family-knit environment. I want you to see the teaching and the learning, the connection between members and staff, connections between members and members. I want you to experience the warmth, the nostalgia, the happiness, the smiles on a little kid's face. The Boys and Girls Club of Boston offer a safe haven, a safe place for young people to learn, grow, and develop, and to embody our mission to be a successful adult and citizen. We offer programming in our 3 priority areas: academic success, character and community, and sports, fitness, and recreation. And for our teens, we offer workforce development and career readiness.
There's not a day that I don't walk in and the staff are not asking me how am I doing or if I'm okay. Over here, I didn't have to worry about anything. I could just worry about being a kid, doing my schoolwork. And now with the pandemic, I'm more grateful because the club is a place that I don't have to stay home when I'm doing school. I can come here, I can have, human contact.
Remote learning at the club honestly made my life a lot easier. It's honestly just like school.
These are unprecedented times where our young people needed normalcy. The Boys and Girls Club reopening provided stability. Even though our dedicated staff are more content experts in aquatics, arts, theater, we adapted to learn how to be proctors and teachers. We invested $60,000 in our infrastructure. We increased our Wi-Fi, our technology, our PPE. It was important for Boys and Girls Club to open as a remote site because our young people emotionally needed the connection with staff and their friends. They were home for a significant amount of time, and so being at the club, they can become physically active again, as well as engage in healthy meals.
My favorite thing about the clubs are the sports. So I can go in the gym, play football, play basketball, which I love doing the most. Athletic director Jeff, he helps me all the time when I'm in desperate need for something, and he's always there for me when I need it.
I'm surrounded with people who I look up to. I'll have a brighter future because of the Boys and Girls Club, because I am presented with new opportunities every day that I honestly wouldn't have gotten if it was just me doing it by myself.
Investing in the Boys and Girls Club is investing in the future, but you're investing in people like me and my sister. I came to the Boys and Girls Club as a child. I went through busing, which was a tumultuous time in the city of Boston, and if it was not for the Roxbury Club, I don't know where I would be. And our young people today, especially children of color, are going through some of the same things I experienced as a child. And I'm here, and the staff's here, to give them hope and to show them that the world is possible for everyone, every race, every color, every ethnicity, to be a part of this great American culture. So an investment in the Boys and Girls Club is an investment in the future.
This is my second home. I know I can come here, be myself, do what I need to do, stay focused on my work, and I have great opportunities when I come here. Thank you. I love you, the Boys and Girls Club. You guys do so much for me.
The Boys and Girls Club is amazing.
Boys and Girls Clubs are the best.
Good afternoon, and thank you again for joining us. We hope you enjoyed the virtual club tour and getting a glimpse into how Boys and Girls Club of Boston is making a difference for youth and families during this unusual time. My name is Patrina Martin-Cherry. I am co-chair of Artemis Circle and a member of BGCB's Board of Trustees. By day, I work as Vice President of Community Engagement and External Affairs at Boston Medical Center. I have the privilege of working alongside today's keynote speaker, my friend and colleague, Dr. Thea James. Thea is Vice President of Mission and Associate Chief Medical Officer at BMC, as well as Associate Professor of Emergency Medicine at Boston University. She manages strategic alliances with BMC's local, state, and national partners so we can meet the full spectrum of patients' needs and work to achieve health equity in the broadest sense. Thea also has a background in public health disaster relief, traveling to support local communities after 9/11 in New York City, Hurricane Katrina in New Orleans, and Haiti after the 2010 earthquake. These experiences served her well this past year when we all had to roll up our sleeves in response to a once-in-a-generation pandemic. Thea and I both serve on Boston's COVID-19 Racial Equity Task Force and have been partnering with community leaders to educate people about vaccines and set up satellite vaccination sites through Boston neighborhoods, bringing the vaccines to accessible locations that they know and trust. Thea understands the importance of community institutions like Boys and Girls Club of Boston in building that trust, distributing essential resources, and communicating effectively with diverse populations. By building unique partnerships with organizations like BGCB, we can work together to improve social determinants of health and equip the next generation of young people with the life skills they need to lead healthy, happy lives. Thea has received numerous accolades, and we are so honored that she can be with us today to share her wisdom. Please help me welcome Dr. Thea James.
Thank you to the Boys and Girls Clubs of Boston for the privilege to share this moment with you today. It is indeed an honor. Growing up, some of the most impactful experiences that shaped me, influenced my development, my character, and my perspective on what was possible for me and my future were the times I spent at neighborhood organizations on a regular basis, designed for youth, like our local Boys and Girls Club, and also another organization called the Hopkins House, for example. And actually, at that time, they were segregated. They contributed to social development, learning about citizenship, responsibility, and most of all, it instilled in me a sense of belonging. I could see my future. I could see myself living fully in the world in my future. It shaped my perspective, my expectation that I could chart my forward path unencumbered by systemic and structural barriers. This is unlike the tattoos that I read on victims of community violence in our emergency department trauma rooms today. Tattoos that read, "Born to be hated, dying to be loved. Living is hard, dying is easy. Death is nothing, but to live defeated is to die every day." These are messages of young people who do not see a place for themselves in the world. These are messages of hopelessness. So the foundation laid in the development that occurs in a young person in the Boys and Girls Clubs is important. because these are opportunities that instill integrity, values, confidence, nurture talent, and they become the formula for creating and capturing value in young humans. This foundation is protection and armor for entering the on-ramp to post-adolescence and adult life, where and when that early foundation and that sense of self are challenged. Those challenges are a societal culture, and they have historically been a constant risk. They are like a nettling poke at the firm foundation that has been created and laid early on. Although that risk is manifested in many ways, I'm going to just name it for its functionality, which is inequity. Most of it is systemic, but it drives our assumptions and our actions. The most unsettling piece about it, though, is something that I am believing more and more every day, that inequity can be unrecognizable. If it is not blatant or very obvious, these structural systems are set in stone, and people cannot see them, even when they might be inadvertently engaging in it. And that's what I find daunting and scary. As the author, Debbie Irving, has so clearly laid out for us in her writings and her talks, even growing up in liberal households is not a guarantee. The most leftward-leaning people often cannot see it. Recognition of a disparity is just not enough. It requires understanding and having a critical analysis on the root of it and eliminating it. Recognition of it is not a solution. And unfortunately, we have a deep societal and cultural narrative that drives this inequity. Now, I am an optimist by nature, but it's not unfounded. I can see light on the horizon because the two most common statements I heard in the past year are, "We are living in unprecedented times," and "I didn't know." Those statements are making references to a pandemic and a revelation, and there is intersectionality between the two. Both give pause for reflection and, honestly, opportunity for a cultural transformation. The one word that describes the engine for transformation is intentionality. Intention toward altering the quality of life course trajectory for everyone. At our hospital, for example, we have made a commitment to not setting low bars for people, but in fact, always choosing equity. And to make it clear, I'll give a few examples. Back in the 1930s, when the economy was a disaster after the Great Depression of 1929, the president at the time wanted to resuscitate our country from that state. And one of the things he did was to use one of the most common ways of building wealth in our country to provide pathways to building wealth for people. And he chose two separate pathways. One was for building homes so that people could gain the advantages of home equity by subsidizing housing developers to build more housing, but only if they agreed not to sell it to people of color. And the other path and option was for people of color, designating the areas they lived in and drawing lines around them and actually making it so that they actually could not avail themselves to the wealth building pathways because they were deemed a financial risk living behind the red lines. And the option was public housing, which some would say was well-meaning and well-intended. But public housing has associated rules and regulations that limit the amount of income people can earn to maintain the housing. So there's a trap. There's really no way out. And why have two separate pathways anyway? But what it has resulted in is two distinct socioeconomic populations in our country. And we can see what that leads to over decades because those redlining maps across our country match the COVID maps of the past year in terms of where the greatest numbers of deaths and incidences of infection of COVID-19 have occurred. And an example of countering that, and an example of intentionality to prevent something like that from happening in every decision we make going forward. One of the things we did was to engage with those communities, making no assumptions. We had the data and knew that those communities had suffered the most. In fact, our hospital became essentially a COVID hospital with 82% of our patients at that time, at the height of the pandemic, being patients who had COVID-19. So what we did to make certain that we addressed that need is we went into the community and we engaged with community leaders, community-based organizations, and we asked them, what would it take? What matters to people? How can we close the gap? And they helped us. We partnered, and it resulted in us creating access in 5 communities. The communities in our area, in our state, that had the highest rates of COVID deaths and COVID-19 infections. And that is not the status quo, but that in fact is the way forward. That in fact is an example of what it means to act with intentionality to achieve equity. I would offer that we give people the freedom and the opportunity to choose their path forward, the same as we do for ourselves. This is our greatest opportunity to achieve equity and to see a transformation from the status quo. Because the young people whose attention we have, this captivated audience, will soon be the adults who are running this world. Thank you so much, and I look forward to what the future brings for all of us.
Hi everyone, my name is Saran and I'm the Teen Education Coordinator at the Yawkey Club of Roxbury. I hope you enjoyed hearing from today's keynote speaker, Dr. Thea James. It is a tall order for anyone to follow such an impactful community leader, but I think you'll find our next speaker to be equally inspiring. I am honored to introduce Oasis Ramirez Mateo, a club member I have had the joy of getting to know these past few years. Oasis is an academic superstar, a known leader within our club, and a compassionate, warm person. When Oasis first joined the club to work in the counselor and training program, I could immediately see the strength in her work ethic. She always pushed herself to complete every task beyond the expectations. She worked extremely hard to receive a bonus and used it to save for her future and her family. Oasis' ideas were innovative and participation was at an all-time high. This experience opened the door for her to do so much more at the club. She joined the swim team, Keystone, College Club, Explore India, and Ready to Work, to name a few. She became a role model to not only her peers, but her 3 siblings. Oasis is ambitious and studious, so much I nominated her for the Christian A. Herter Scholarship, a 4-year academic scholarship when she was only a sophomore, and she won. This past year, I stayed in regular contact with her through the college advising meetings and check-ins. Despite the struggles during the pandemic, Oasis demonstrated a strong will to face these challenges, which is an immensely admirable asset. She is resilient, personable, and a go-getter with a very bright future ahead of her. No matter where she decides to go to college this fall, Harvard and Spelman have accepted her, but she is still waiting on a few more decisions. I have every confidence that Oasis will excel and make a difference in our community. It has been such a pleasure to know her, see her exemplary growth in the leadership pipeline at Yawkey, and watch her blossom into the young woman she is today. I hope you enjoy hearing her story. Without further ado, please welcome Oasis.
Thank you, Saran, for that introduction, and to all of you for attending this event in support of Boys and Girls Club of Boston. My name is Oasis Ramirez Mateo, and I'm a senior at Boston Latin School and a Yawkey member of Roxbury for almost 4 years, which has been there to support me personally, professionally, and scholastically. Whenever I stepped foot into the building, I would be greeted with friendliness and check-ins from club staff. And I even had my own corner in teen education where I could focus on my work, which was always there for me whenever I entered. All in all, the club makes me feel safe, welcomed, and respected. One program that I thoroughly enjoy participating in is Keystone, which is a leadership program that has allowed me to tap into different definitions and examples of leadership since I have further developed my interpersonal skills and connect with several different communities. As a part of Roxbury Royalty, another name for the group, I am thrust into a more personal leadership role than I am accustomed to. I'm able to talk to the youth as if I'm a mentor and not just some upperclassman who happens to go to the same club as them. And another program that impacted me is the Boys and Girls Club sponsored trip to India, which was quite a wake-up call for me in many ways. And one of the realizations that stuck with me is my need to take care of myself. I suffer from something called compartmentalitis, where people tend to put their emotions and stress in faraway filing cabinets for future use. But I never went back to those cabinets, if we're going to be honest, as I was supposed to. And when we arrived at the Sikh temple in New Delhi, with its man-made lake, marble floor, gold shrine, and people engrossed in their faith, my filing cabinets burst. It was very much like that one SpongeBob episode where he's frantically searching for information he lost, but he can't find it. Yet mine was more like an outpouring of tears. My filing system was defeated, and I needed to manage with the feelings I purposely locked away, a powerful realization that I still grapple with. And throughout my club experience, the staff have consistently been there for me during my life. Saran interviewed me for my first job. She nominated me for a 4-year academic scholarship that I won and has supported me throughout the college process with financial aid applications and scholarships. While Keith is just an all-around great mentor and advisor. He certified me for lifeguarding, and he continues to check in on me and my schoolwork to this day. But BGCB's support has integrated itself in more ways than that, like through Ready to Work, which is a workforce development initiative that ensures a paid internship during the summer. And through Ready to Work, I participate in Expanding Your Horizon, which is a fellows-led podcast on leadership. And quite simply, I love it, since I've been able to interview community leaders like David Velasquez, who is someone I see myself as in the future since he has a medical doctorate and pursues a master's in public policy at Harvard. So through these interviews, all in all, I learned a little bit more about myself and my values, as well as how to establish personal boundaries, what success means, how to take risks, and essentially, how to grow as a human being. Now, I have to warn you, I may be 17, but I am 71 in soul and in body. And as a result of my club experiences and this well-known fact, I hope to achieve higher levels of education and remain intellectually curious. I've always been fascinated by those people with a lot of degrees following their names, and I want to be just like them. I've always secretly desired to be the wise old crone from all the fairy tales that counsels the protagonist, and I believe that education and life experience can get me there. Furthermore, I want to be a well-learned OBGYN, obstetrician gynecologist, with a master's and PhD, because I was struck and rattled by my mother's experiences dealing with necrosis postpartum from my youngest siblings, and recognize that there are countless of other instances where self-advocating strong women are dismissed, silenced, and alienated by their physicians. Furthermore, women of color are marginalized on both spectrums of healthcare, as patients and as workers, as providers as well. And so I want to enact institutional change in the treatment of women and women of color in healthcare. That being said, I thank all of you for attending, my mother for pushing me towards my ambitions and opportunities, and for being my rock, the club and Boston Latin School for supporting me throughout my high school career and laying the foundation for a lucrative college and post-secondary network, and my plants for their faith and grace that they always seem to give me as I try to take care of myself as I take care of them. Thank you.
Hi there, my name is Donna Venegas, co-chair of Artemis Circle. First and foremost, I'd like to thank Oasis for sharing her story. Her drive truly inspires me and is a great example of all that BGCB strives for with their club members. Thanks to the programs, opportunities, resources, and supportive relationships provided by the club, Oasis has made incredible strides towards the future she dreams of. As she transitions to college next year, she'll continue to carry with her the life lessons and skills that she learned at BGCB. A few years ago, I spoke at this event about how BGCB is like a giant safety net spread out across Boston and Chelsea, catching the children and teens who need us the most. That sentiment has never been more true than over this past year. Despite unprecedented challenges, BGCB never wavered from fulfilling their mission and doing whatever necessary to be a reliable, affordable, and positive resource for its club members and families. Our safety net has proven stronger than anyone could have imagined, and it's woven together by contributions from staff, parents, mentors, and generous supporters like you and I who make their work possible. Ultimately, the common thread we all share is a belief that all children deserve opportunity to be all they can be. Did you know that BGCB asks families to pay only $25 for a child's entire school year membership and just $5 for teens? No child is ever turned away due to an inability to pay, and every child receives all the benefits that we've heard about today, including enhanced academic support, healthy meals, swim lessons, leadership programs, opportunities in music and art, and safe spaces both in person and online to connect with trusted mentors and peers. The past year has shown us that BGCB is more than just a physical place. What makes BGCB vital in our community are the impactful relationships that caring staff develop and nurture every day. Of course, the cost to provide these programs and services far exceed the membership fees. Boys and Girls Clubs of Boston's operating budget is $26 million, 80% of which comes from personal donations and institutions in the community. As we said at the start, Artemis Circle is driven by our collective power, by all of us banding together so that every child has a fighting chance to achieve their wildest dreams. We know many of you have already given generously, and we thank you for your support. We hope that everyone will join us in investing in our community's greatest resource, its youth. You can make a gift by clicking the donate button on your screen. Gifts of all sizes are appreciated and will make an impact. What matters is that we're all doing our part together. If you're feeling inspired by Oasis and the staff that helped her become who she is today, I hope you'll join me in giving generously. If you want to change our world for the better, join us in supporting a vital organization that develops and lifts up the future leaders of our community. On behalf of the Artemis Circle Leadership Committee, BGCB staff, and all the club members and their families, thank you. Thank you for joining us for this impactful afternoon, and thank you for all you do to support Boys and Girls Clubs of Boston. We hope to see you again soon.
Thank you again for joining us for our 8th annual Artemis Circle Spring Luncheon. We are so grateful for your generous support of Boys and Girls Clubs of Boston, and we look forward to seeing you hopefully in person at our next event. That concludes our program, but all are welcome to transition to Zoom if you would like to connect with BGCB staff for additional Q&A or socialize with each other in private rooms. Please follow the prompts on your screen to move to Zoom if so. Otherwise, thank you and have a wonderful afternoon.